Population aging in the Caribbean is real and imminent. Aging is a global trend caused by both falling fertility rates and increased life expectancy. Over the next 25 years, the number of persons aged 65 and over in the Caribbean will double. Over this period, the number of working-age adults will fall from 67 to 64% of the population, and the number of children from 23 to 18%. By 2050, there will be twice as many people in their 70s, 3 times as many people in their 80s, and 4 times as many people in their 90s. So what are the consequences of population aging in the Caribbean? There are risks that we all face as we get older: loss of income, ill health, disability, loss of independence, loneliness, abuse, and neglect. The dramatic aging of populations over the next few decades will place huge demands on social protection systems that don't adequately meet the needs of today's generation of older persons, let alone future generations. Pension systems must be strengthened. Many people are not covered by national insurance schemes. Coverage of these schemes vary from 45 to 80% of working-age adults. In most countries, the incomes provided by non-contributory pensions fall well below national poverty lines, and there are many older persons with no pension income at all. Older women in particular, who have spent their lives working in the informal sector or the home, receive lower pensions or none at all. Some of these persons are able to continue working, although opportunities to work diminish with age. This can leave older persons living in poverty, forced to choose between purchasing food, medication, or maintaining their home. At worst, they can be left destitute. Population aging, together with unhealthy lifestyles, will contribute to a surge in cases of non-communicable diseases, or NCDs, including cardiovascular disease, cancer, type 2 diabetes, hypertension, and Alzheimer's. In 2000, in Latin America and the Caribbean, 67% of deaths were caused by NCDs. By 2030, it will be 79%. Diabetes is particularly prevalent in the Caribbean. It was the second leading cause of death in Jamaica in 2013. Aside from the human cost, the financial cost of NCDs is huge for both governments and individuals. The total cost of diabetes to the Jamaican economy has been estimated to be equivalent to 2.7% of GDP. For individuals suffering from NCDs, medical costs can account for 1/3 of their total spending. NCDs, like diabetes, not only increase the risk of early death, but also cause disabilities, including the loss of mobility, speech, or vision. So how is aging being addressed? In global and regional agreements, governments have committed to implement policies and programs for older persons and to increase protection of their human rights. In adopting the Sustainable Development Goals, which seek to realize the human rights of all, the United Nations General Assembly pledged that no one would be left behind. To fulfill this, more must be done for older persons, including ensuring that older persons have adequate pension incomes, improving access to health care for older persons, especially secondary and tertiary care, providing comprehensive prevention, screening, and treatment for NCDs, expanding palliative care services, strengthening the provision of social care services, including regulation and monitoring of providers, promoting lifelong learning programs, physical activity, and social participation, and creating legislation to address elder abuse. We all want to enjoy an active and healthy old age in which we can depend on a pension and high-quality health and social services. The Economic Commission for Latin America and the Caribbean, ECLAC, remains committed to working with governments and civil society to realize these goals for the future security and well-being of all Caribbean people.